My name's Fiona and I'm mum to Jack, who's 23. Jack's got learning difficulties. He's got quite complex needs. He's got epilepsy and quite a rare epilepsy syndrome. And Jack has gone through transition. He's now been 3 years in his own house, supported with 24-hour support with a team of trained carers. Jack is their only client, and they've been specifically trained to look after him. The process of transition was disappointing. I mean, we always knew, because Jack's needs were quite complex, that it wasn't going to be easy. We were hoping for him to leave school at 18 and come to live within our local authority, because he was in Outerborough provision. The local authority just could not get any package of support together. So he stayed an extra year in school, hoping that by that time we could get something sorted. SDS came in, self-directed support, which is now citizens-directed support. And we saw that as a fabulous opportunity to provide something that would be really tailored to Jack. We were able to use that funding in a flexible way with a little bit of an ILF component. And it has worked amazingly well for Jack. His confidence has grown enormously since he's come home. He's got more contact with his family. We see him every day. He lives in a house just a couple of doors down from where we are. And he's really part of the community. Challenges, first of all, timeliness of local authorities, the expectations, we talked about we needed to get housing in place, we needed to get funding from health and social services. He has 50-50 joint funding. We had a time scale. Jack was leaving college. I had actually inducted staff, and through a small pot of funding I got from direct payments, I had them inducted and trained, waiting to take place. The funding didn't come through on time. I actually got an overdraft to pay my staff for the first month of their work. Housing, nothing came through. We ended up having to privately rent a house, and then we bought a house. Nothing, even though they had an extra year, the timeliness of these agencies is just, really not good. We've had 3 fantastic years. It's worked really well with his own staff. They've grown in confidence. Jack's got a level of trust with them. It works really well. We knew that having agencies wouldn't work with Jack. He has communication problems. People need to learn his complex communications. The challenges that I see now for the future is we're just going through the assessment process, and they're doing critical reviews, and they're looking at the package that Jack has. And my fear is that there is definitely an agenda to cut funding, and we can understand that, but we need it to be done in a way that we're working with them. And my fear is they're doing it by assessing my son and downgrading or changing what are his perceived needs, and I find that dishonest. I've already complained. When I saw his most recent assessment that said my son with no language, my son with complex epilepsy, with severe learning difficulties, according to the assessment, he was able to go to the shops on his own and manage his own finances. He can't even talk. So when you see things like that, it really does, make you wonder what the agenda is there. So, we're determined to fight for Jack. We have all throughout his school career and through transition. When Jack was in school, he had a key worker. He had a member of staff who was assigned to Jack, and actually when we moved into the community, he actually worked with Jack. He left that job. We employed him to work with Jack, and he was part of training up other staff members. And we know how important it is for Jack to have key workers So in effect, all the staff, all the people who are working with Jack are key workers. I mean, one of the wonderful things is they are there for Jack. They're his advocates. And if that means standing up against Mum and challenging me, which they have done so many times this weekend, you've got to let Jack do that. Of course he can do that. I'm saying he can't do that. That might be dangerous. You know, and I've actually really grown in that process and learned how important it is to have somebody who is emotionally separate, but has your child's best interests at heart. And yeah, it has worked amazingly well. My aspirations for Jack is that he continues to grow in confidence. When we were going through the process yesterday about looking at different aspects, I realised that one of the things I was saying is Jack is fine actually at home. He doesn't need to have lots of wide social circle. And actually coming away and seeing him interacting with other young people, one of the things that we've actually taken from this weekend is that he does enjoy that. He does need to have that interaction, even though he initially finds it difficult. And that is actually something that his key workers are going to be nagging and making me make a significant change for Jack. And that's the thing, is he's a young person. He's not a child anymore. And, you know, looking to his future with hope and ambition. You know, we're not looking for care and containment. We're looking for him to grow and develop and to reach his potential. And I think this is something that I feel with his team and with people who are, you know, keep working for Jack, who are confident to challenge parents, confident to challenge other professionals. We're going to achieve it. Just need to get the funding to do that.